If we look back, healthcare is often been thought of as being something that happens in a clinic or in a hospital or an emergency department. And what we know is that most of the reasons that someone's health improves or worsens don't happen in a clinic, don't happen in a hospital. They happen in the home, in the community.
When you do population health management the right way, it's a win-win in all directions. It gets patients good care in a timely fashion. It allows the healthcare enterprise to work more efficiently, which is great for doctors and hospitals. And it also reduces the cost of care, which payers and insurance companies benefit from as well. It's not just understanding the clinical care, it's also understanding the data and analytics that inform the clinical care. By looking at data in a very deliberate way, you can understand patterns of healthcare utilization, and you're looking for patterns that make sense, but sometimes you're also looking for patterns that don't make sense. It helps us identify the opportunity, then the rest of our team, care managers and others, capitalize on that opportunity.
Having particular things that come to the forefront with these analytics that are sometimes provided to us, they allow us to see these patients and go, oh yeah, we need to talk about this. You're not in there pushing everybody aside and saving lives, but rather you're doing it in an incremental way on a daily basis.
In that 15 minutes or 30-minute engagement that provider has, they just have a snapshot. And so our staff are able to see the patients in their home, in the community, and connect some of the other dots that the provider might not have access to.
It's great to have that person between me and the medical profession. I have great faith in my doctors, but it's a little bit tough to sit down at the phone and call your doctor and discuss something. Whereas having Chris available, I can ask her any question, she gives me an answer, and it's invaluable to me.
When I go to my medical appointments, she would let me know exactly what I would have, what I would go through at that appointment. She'd help me with that, making sure I'm making my appointments, taking my medicines, and all of that. She cared.
I am no longer pre-diabetic. I've lost 100 pounds. My blood pressure is under control. I'm sleeping better.
The goal of the PHMO is really to get the patient to the right care at the right time at the right place.
As we look out a year, 2 years, 3 years, we know that we'll be increasingly in a relationship where we'll be looked to manage care much more comprehensively. Not to think about a transaction or an encounter, but to think about the total patient. Think about their health and outcomes and how we can improve that working in concert with the patient, with the payer and employer as well.